Hello all, my name is Britzer and I'm a PhD scholar from the University of Bedfordshire, undertaking my research in the field of organ donation. By undergraduation, I'm a physician assistant, following which I worked for 2 years in a liver transplant team. At this time, I had a realization that I need to contribute even more to the area of transplantation and organ donation, following which I pursued my master's in public health at JIPMER in India. During my master's, I undertook my thesis in organ donation and also a 4-month internship in a leading organ donation organization back in India. During these times, I was involved in various aspects of research, right from the development of proposal to the stage of publications. During this time, I also understood that I had more need to further my understanding toward organ donation research, following which I was offered this PhD by Professor Gurj Randhawa at the University of Bedfordshire under Global Challenges Research Fund. With my background in the field of organ donation and transplant in India, my PhD research is based among Indian population. As we all know, India is the largest populated country in the world, having more than 1.3 billion of population. And with such a large population, the culture is varied as per the regions that an individual lives. The culture of food, the culture of belief, and customs and norms differ with different regions in India. And also the health-seeking behavior and the health indicators are different among different regions of India. In such a country, when organ donation was implemented, the law which was initially developed was based on the British law, which is the Human Organ Transplant Act 1989, with slight modifications according to the need of the country. As you all see the graph on the slide, the trend of organ donation practices right from 1970s, the blue line represents the living organ donation practices, while the orange line represents the deceased organ donation practices. And there is a visible gap and a wide gap between the living and the deceased organ donation practices in India. Also, a recent report in 2019 showed that only 8% of the organ donation practices are based on deceased organ donation, whereas the remaining 92% are based on living organ donation practices. As I have mentioned to you earlier about the diversity within the country India, they are so diverse that their culture, their beliefs, their norms differ according to the region or the state that they belong to. And also, they differ even in the health-seeking behaviors and the health indicators. This is no different with organ donation practices. The national organ donation rate of India is less than 1 per million population, and the rate varies according to the state or the region. However, the southern part of India is shown to perform well in organ donation practices, especially the state of Tamil Nadu, which has the highest number of organ donors compared to the other parts of the country. This clearly shows the differences in practices towards organ donation between the north and the southern region of India. However, on an overall scale, on a national level, there is a greater gap between demand and supply. On the graph that you see in the slide, the blue color represents the demand, and the orange color represents the supply of the organs, namely liver and kidney. And this clearly shows the gap between the demand and supply, and the greater need to satisfy the need of organs. With such a background towards organ donation practices among Indian population living in India, this is no different even among the Indians living in the United Kingdom. Both Indians living in the United Kingdom and in India are disproportionately represented in the organ donor waiting list and the organ donor registered list. While there is a higher representation in the organ donor waiting list, there is a lower representation in the organ donor registered list. There have been several research conducted to understand the factors that influence organ donor registration or organ donation behaviors among the Indian population, both in India and the United Kingdom. However, there is a lacunae to understand them collectively. While many research has been done, there is no systematically reviewed literature to understand them in an overall scenario. Therefore, as a part of my PhD to understand the barriers toward organ donor registration and consent among people living in India, I have also undertaken an integrated systematic review to understand the barriers towards organ donor registration among Indians living in India and the United Kingdom. And hence today's presentation will be majorly based on this integrated systematic review and the findings that have come out through this review. To begin with this review, a scoping of literature was undertaken using several key terms and mesh terms related to organ donation research among Indian population, during which it was identified that varied evidences, right from commentary to original research, were available. And hence integrative systematic review methodology was adopted. This was mainly adopted because it gave the freedom to include both quantitative and qualitative studies which had the potential to address the research question. While there are varied data synthesis methods involved in systematic reviews, right from meta-ethnography to meta-analysis, integrative systematic review majorly used narrative synthesis. This was again mainly due to the reason and the freedom that it gave to include both quantitative and qualitative studies in a narrative format. All the studies which were included in this integrative systematic review were appraised for their quality using JBI Quality Appraisal Tool. Again, JBI Quality Appraisal Tool had both tools to appraise quantitative and qualitative studies. After critical thinking and understanding, the protocol was developed and the ethics committee has approved, following which it was registered in Prospero and also published in BMJ Open. Out of many studies which were extracted from the database, several databases, as shown in the figure flowchart, 50 studies were included in the final review stage. Studies were extracted right from January 1994 to May 2021, out of which 50 studies were included in this review. And majority of the studies which were included in the final review were quantitative, which is 46 number of studies out of 50 were quantitative, where only 4 were qualitative studies. And the total number of participants from all these studies were more than 16,400. And the individuals were majorly from India and few from the United Kingdom. And in India, it varied across the country and it was from various states and union territories. And the study population was majorly 44% of public and 41% of student population, with majority of the studies published somewhere between 2015 to 2021. The findings of this integrated systematic review showed 6 themes in the narrative synthesis process, such as knowledge and awareness, behavioral intention, familial influence, fear and mistrust, religious issues, and bodily issues. And hence, the further findings of this integrative systematic review will be explained under these 6 domains. With regard to knowledge and awareness towards organ donation, majority of the studies showed that majority of the participants have heard about organ donation or even have adequate knowledge towards organ donation. It also showed that majority of the individuals related organ donation behavior or even the act of organ donation itself to a positive moral norm. It also showed that knowledge had a positive correlation toward their willingness to be an organ donor. However, when you look at the graph, the blue bar represents the knowledge or awareness towards organ donation, which is higher in all the studies. And when you look at the orange bar, which represents the willingness to be an organ donor, there is a difference identified compared to the knowledge towards organ donation, and there is a gap also identified. While we further down the question to understand the proportion of individuals who have actually registered, the proportion is even more negligible. The difference between willingness and the actual registration practice is even more wider than the gap between knowledge and willingness. There have been several studies conducted to understand this gap, which would be discussed in this following slides. It was identified that willingness and the actual registration behavior was found to be higher among the southern region of India compared to the other regions. It was also identified that certain groups showed higher willingness to be an organ donor, but several other studies also showed that it did not hold true during the actual act of consent or registration. Several studies have been conducted, as I would be explaining to you in the further slides, about the various factors that influenced this willingness, such as religion, bodily issues, mistrust, healthcare system structure, and various other constructs. However, there is a lacunae to understand even more deeper towards how such constructs, such as family or beliefs or norms or religious practices or the trust in healthcare system actually influenced the behavior towards organ donor registration. And hence there was a gap and a need identified to further research in such areas. Majority of the studies showed that majority of the participants have opted family as a barrier towards organ donation or organ donor registration. However, when further probed on evidences to understand the proportion of individuals who have actually had a discussion on organ donation with their family members or significant others, it was identified that a very minimal proportion of individuals have actually done it, which is very negligible. This showed that though family members were opted to be the major barrier towards organ donation, majority of the individuals have even not discussed the issue with the family members. This showed more to be a perceived barrier to indulge in such behaviors and not a barrier by the act of discussing itself. It was identified that such talks arised with the family members among the individuals who did so only at the time when such information were displayed around them. And this is how the family was shown to act as a barrier towards organ donation. However, when looking at studies conducted in the United Kingdom, the younger generation were more willing to discuss and have discussed such issues, and the familial issues or the familial norms or culture did not look to be a barrier to such individuals of Indian origin who grew in the United Kingdom. Trust toward the healthcare system was found to be the next major barrier towards organ donor registration or even organ donation itself in majority of the studies. There was a fear among the participants about premature declaration of death. The participants were afraid if the healthcare system would declare their loved ones to be deceased or brain dead for the sake of organ donation or for the sake of the organ trafficking reasons. Also, this was not just found to be evident or demonstrated among Indians living in India. This was similar even among Indians living in the United Kingdom. A qualitative study showed that a mother was afraid about her son getting registered in organ donation registry, mainly because if he would be declared dead by the healthcare system just for the sake of organ donation to happen and not concentrating on saving her son, but rather concentrating on retrieving the organs. This was found to be major both among Indians living in India and the United Kingdom. Religion and bodily issues were identified to be the least barrier towards organ donation across majority of the studies. With religion, there was no homogeneity or there were no similarities across the studies conducted to understand which religion or individuals from which religion are more willing or are more supportive toward the concept or the phenomena of organ donation. Also, there was heterogeneity even within the same religion. For instance, a qualitative study showed that individuals uh, replied saying that body is very important for the process of reincarnation, whereas individuals from the same group and the same religion also informed that body and soul are two different entities, and it is the soul which matters to the next life and not the body. And hence there was heterogeneity across the religion and also heterogeneity within the religion. However, religious influence was found to be correlating with the willingness to be an organ donor. Also, younger generation was identified or demonstrated to be not influenced by such religious practices or religious concepts, as they all related religion is a concept that helps individual to live a good moral life, and organ donation is related to a moral norm, and hence the younger generation viewed organ donation to be supportive from the religious point of view. Also, bodily issues were related to religious practices. For instance, last rituals. The practices held by different religious groups were identified to be related to religious issues, which served as a barrier towards organ donation. Also, individuals opted and informed that it is the willingness or it is the will of the deceased or the will of an individual to opt for organ donation, and no system or no structure can force an individual to make such decision to donate an organ. Also, stakeholders informed that it was easier to get consent for eye donation compared to gaining consent for solid organ donation, which may include incision or cuts in the body surface. And hence this is how religion and bodily issues show to influence organ donation behaviors among Indian population. Through this integrated systematic review, it was identified that majority of the participants, especially Indian participants, which was the concentration of this review, it showed that majority of them have heard about organ donation or have adequate knowledge towards organ donation, and also that they hold a positive moral norm to the organ donation behavior or the act of organ donation itself. And there is a gap between the knowledge and willingness, and there is a wider gap identified between willingness and the actual practice of registration. While several studies have been conducted to understand the willingness, majority of the studies, or even almost all the studies, have undertaken a similar method or similar approach and even similar aim or research question or objective to address, which led to repetition of studies and saturation of information, and lacked further depth in understanding how various factors which were identified to influence organ donation behavior did really influence this phenomena. For instance, how did family influence, or how did religion influence, or how did the trust play an important role towards organ donation behavior? These kinds of research or deeper understanding towards this phenomena will help us to widen our knowledge towards the scenario and help to improve the organ donation rate among the Indian population. And also it would help in gaining or to support more effective and efficient campaigns that has a greater impact in improving the organ donation rate in India. There was also some methodological issues identified in this review towards organ donation research among Indian population living outside India. For instance, studies conducted on such phenomena among Indians were collectively called as South Asians, and those studies included participants from the neighboring countries of India also. And the findings were collectively addressed, considering this group, which is the South Asian group, to be a homogeneous group. But again, a study from the United Kingdom showed the difference between two countries, namely India and a neighboring country which share the same border. How different are they in their thoughts or in their beliefs and norms towards organ donation behavior, showing how heterogeneous this population is. And also again, this was again in the American continent, more included with other Asian population, which is sometimes even not the neighboring countries, and collectively address their barriers. And hence there is a need to address such methodological issues towards organ donation research. This would help us to even more deeper our understanding toward the phenomena among this particular population. And there is a greater need which has been identified. Through such identification, my PhD research have undertaken to address such gaps identified through this integrated systematic review. With the identified constructs which influence the organ donation behavior among Indian population, and with the diversity of health behavior practices and the organ donation rate and the health indicators in India, my PhD tries to underpin the barrier towards organ donor registration behavior and consent from two diverse regions in India. My PhD study employs a socio-ecological theoretical perspective from a social constructivist paradigm using qualitative research design to address the aim and the research question of my PhD study. A careful and a critical thinking were considered in order to address the aim of this PhD study through the strong methodological approach. The further slides will explain about the relationship between a socio-ecological theoretical model and organ donation, and the relationship between social constructivism and organ donation, particularly in India, and the need for qualitative research to address the aim of the study by the socio-ecological model and the social constructivism paradigm. Several theories have been employed to understand the phenomenon of organ donation, such as the theory of recent action, theory of plant behavior, gift exchange theory, health belief model, and several other theories. And each theories have their own alignment to their research questions. While these had a particular individualistic approach towards the behavioral intention of indulging in organ donor registration or the behavior of organ donation, my PhD study on organ donation has adopted the socio-ecological model. This is mainly because with its alignment with the existing information from the previous published studies among this particular population. While socio-ecological model explains that the behavior of an individual is not just influenced by the individual itself and what is happening inside an individual's mind, but on its interaction with the constructs around or the society in which an individual lives. For instance, the religion or the peer groups or the family or the community or even the healthcare system. This theory was basically developed by Yuri Bronfenbrenner and also further developed by McLeroy and Stockholz. This theory has also been employed in various organ donation studies to understand how various levels of a society actually influences the organ donation behavior. Now, this theory has mainly been adopted in my PhD study because of the evidences which show that the behavior is not just influenced by the individual's own knowledge, but various other factors such as the interpersonal relationship with family or the community or the religion or even the healthcare system. And hence this model has been adopted to understand the behavior towards organ donation in India. To understand the paradigm which is related to the social ecological model and to the evidences available from the previous literature, various paradigms were studied, and social constructivism was identified to be aligned and appropriate with the socio-ecological model. While socio-ecological model informs that an individual's behavior is influenced by the interaction between the person itself and the environment where that individual lives. Again, social constructivism, according to Payton 2014, argues that a principle is constructed interpersonally and intersubjectively by a people interacting with a network of relationship. The ontological relativity of this study is that diverse people live in the same area or different regions, but perceive the same event or a phenomena from different lenses. For some, it will be a religious issue. For some, it will be a trust issue. And this again aligns with the socio-ecological model and the previous existing literature, that the behavior towards organ donation among Indian population, it's not just influenced by their own thought, but it is socially constructed according to the place where they live or the culture that they are brought up in. On the other hand, the epistemological philosophy is revolving around like how do we reach to such an ontological relativity, or how do we get to the truth of such diversity. And hence an appropriate research approach has to be identified and employed, which has to be aligned to the previously existing literature, to the socio-ecological theoretical perspective, and the social constructivism paradigm. According to Nelson et al. 1992, and I quote, "Choices of research practices depend upon the question they are asked, and the question depend on their context." The literature review shows that the context is that the influence of organ donation behavior is not individual but various influences like the culture, familial influence, religious beliefs, norms, bodily issues, and the healthcare system practices. And the question is, what are the barriers toward organ donor registration? Well, the context is that it is multidisciplinary or multi-level influences. The research practices and the theoretical paradigm, which is social constructivism and socio-ecological model, it probes or it leads to understand the subjectivity relationship with the phenomena, and hence a qualitative research approach is being employed in my PhD study to understand it from the view of the community members from two diverse regions and different age groups and sex, and also from the view of the stakeholders from that respective regions, to understand how the behavior towards organ donor registration and consent is being constructed by the various levels identified from these two diverse regions in India. The outcome of this study is the empirical findings that how various constructs are influencing organ donor registration behavior and consent, and it goes even more deeper than the previously existing knowledge from a positivist point of view or from a reductionist point of view, and go even more deeper to understand in more depth from a subjectivist point of view and in a broader aspect towards the influence in this phenomena of interest. And also theoretically, this study is aligned with the previously existing knowledge or evidences to the socio-ecological model and the philosophical paradigm of social constructivism, and to understand their subjectivity from using qualitative research approach. This even broadens the idea of research back in India and among Indian population, and helps in moving the research to a different paradigm, to move the horizon of research in India and to get a deeper understanding that will help the policies to be more efficient and more effective, as such researches will be carried out among Indian population in the future years to come. Identification of the barriers with such deeper understanding will help us to address the situation, address the barriers with more effective campaign to improve the organ donation rates in India. I thank Dr. Mel Hyde and Professor Barbara Massa for giving me this opportunity to be a part of this donor research network, and also an opportunity to do this presentation as a part of this week of talks. It is also a wonderful opportunity to listen to the other researchers who have been researching in the area of donor behavior, and it helps me to widen my knowledge towards the aspects of research within the donor behavior. Thank you so much for this wonderful opportunity, and I also look forward to be connected and being updated with other researchers. Thank you.